In the vast realm of medical mysteries, few conditions spark intrigue and frustration like peripheral neuropathy. Picture this: a patient experiencing unexplained tingling, numbness, and pain in their feet or legs goes to their doctor looking for answers and solutions. But instead, they get labeled with the dreaded term idiopathic neuropathy, meaning of unknown cause or origin. Well, what if I told you that many cases of peripheral neuropathy are hastily diagnosed as idiopathic simply because they weren't caused by diabetes or chemotherapy? This is a sloppy misdiagnosis that can hinder a person's ability to recover. So, in today's video, I'll reveal many hidden toxins that are overlooked and can cause peripheral neuropathy. Gang, trust me when I say this. This could be a key piece to your recovery. You don't want to miss this. Coming up. Hey gang, Dr. Valerie Montero here. If you're finally ready to conquer your peripheral neuropathy, reclaim your life, and start living again, then subscribe to our channel and don't forget to click on the bell so you're notified as soon as we publish new content. Are you ready to dive in? Let's do it. Well, I want to begin with the question first. How many of you were diagnosed with idiopathic peripheral neuropathy? Let me know in the comments down below. And also, I want you to tell me how this made you feel when your doctor told you there was no known cause. This diagnosis is what we call the lazy doctor's diagnosis because it's slapped on very quickly when a peripheral neuropathy sufferer doesn't have diabetes or hasn't been through chemotherapy. So instead of digging deep into the patient's medical history and lifestyle, the doctor very quickly labels their case as idiopathic and tells them it's permanent and then sends them out the door with medications, and not to mention despair. It's much easier to do this and to get to the next patient that's waiting than to take the time to actually figure out the cause. When Dr. Koppel and I meet with a peripheral neuropathy patient, we spend at least an hour, sometimes longer. And for the first half hour or so, we're reviewing their past and present medical history and also their lifestyle, which reveals a lot. And usually within 15 to 20 minutes, we're able to identify the exact cause of their peripheral neuropathy. Right, Chloe? Yeah, she usually helps us. Well, I can honestly say that out of 15,000 cases we've treated, there have been less than 1% where we weren't able to pin down the cause. Now, when's the last time you went to a doctor who spent more than 10 minutes with you one-on-one? Not their staff or their nurse practitioner or their PA, but the doctor. In this day and age of managed healthcare, it rarely happens. And that's why so many people are walking around with this diagnosis. I've got to tell you, when I talk to my patients that have been labeled with this idiopathic diagnosis, they tell me that they literally leave their doctor's office feeling bewildered, frightened, and they truly feel like their life is over. Guys, having walked this road with my mom, I can really relate to this because I know how absolutely horrible it feels when you're handed down this diagnosis and how the patient is left feeling scared and hopeless. So today, I'm going to shine light on quite a few of the hidden causes of peripheral neuropathy that the average doctor isn't aware of. This will help you understand not only what might have caused this in your case, but also what you can do to take the burden off your nerves while they're healing. This will also prevent your neuropathy from coming back later on down the road. Okay, guys, so get ready to hold on to your seats. This hidden cause is one of the largest that most doctors are unaware of, and they're totally unaware of its link with peripheral neuropathy. The category is chemical toxicity. We have far more chemicals in our environment today than we did 200 years ago or at the beginning of the Industrial Revolution. Our exposure to these toxins can occur from breathing or from absorption through the skin or eyes. We can also absorb them from the foods or beverages we ingest that contain preservatives, colors, and other chemicals. And, I've got to tell you that these toxins are wreaking havoc with our nervous system and really our overall health. The Environmental Protection Agency lists some of the most common chemical toxins we're exposed to, leading to the drastic rise in many diseases like cancer, neurodegenerative diseases, autoimmune, and chronic illnesses. So let's take a look at some of these. Right, Chloe? No, you're more interested in looking up there? All right, no problem. The first ones on our list today that I want to cover are heavy metals. The most common heavy metals we're exposed to are mercury, lead, cadmium, and arsenic. These rank the highest in our environment due to medical uses, like in the case of mercury dental fillings, also from agricultural uses, as is the case with pesticides, herbicides, and fungicides, along with synthetic fertilizers. And we also have large application of these heavy metals into our environment from industrial and technological companies. So let's look at mercury first. Most people gain mercury exposure from dental amalgams, also known as silver fillings. The mercury from these fillings will outgas into your mouth and your bloodstream for as long as you have these fillings. The simple process of chewing or consuming foods and beverages that are highly acidic will also accelerate the outgassing of mercury into your body. There's been extensive research done on this topic. I'm going to include a link below to a shocking video on this topic. It really is quite an eye-opener. Also, it may surprise you to know that in 2008, European countries like Norway, Sweden, Denmark, and Germany banned the use of mercury amalgams. Here's another bit of trivia. These countries rank in the top 10 for being the healthiest countries in the world. In 2018, the rest of the European Union adopted a regulation that banned amalgam use in children under 15, also in pregnant women and breastfeeding women. Now, before you breathe a sigh of relief because you don't have dental amalgams, you may still have a significant amount of mercury exposure if you're consuming certain fish on a regular basis, like tuna, mackerel, marlin, orange roughy, grouper, Chilean sea bass, bluefish, shark, swordfish, and tilefish. These have the highest levels of mercury. Now, you can download an app on your phone to see which fish you should avoid and which are safer to eat and lowest in mercury levels. Now, I'm not going to spend much time on lead because fortunately, we're seeing less and less of this exposure in the 21st century. It predominantly came from lead-based paints and hobby materials, and also from drinking water from households containing lead-based pipes. However, one that I do want to shine a light on is arsenic. We get exposed to arsenic in our drinking water supply and in the irrigation of food crops, also through industrial processes polluting our air and our water supply, and by eating contaminated foods. Arsenic can be found in rice crops, believe it or not. The nonprofit organization called the Environmental Working Group, or the EWG, has found that rice grown in California or imported from Southeast Asia is often lower in arsenic levels than rice grown in other parts of the U.S. Now, I'm going to share a method that I use for eliminating much of this arsenic that you're going to find in your rice. I came across this method in a research study, which I'll share with you below. You want to place 1 part rice to 12 parts water in a pan and bring it to a boil. So that would be 1 cup of rice to 12 cups of water. Once you bring this to a boil, you're going to drain the water and rinse the rice. Then you can go on ahead and cook it as you normally would. Research shows that this will reduce your arsenic levels by 57%. Now, if you repeat this process a second time before you cook the rice, you can potentially reduce your arsenic levels by up to 75%. Gang, Dr. C and I do this, and it only adds about 10 more minutes to our cooking time, so it's well worth it if you're going to eat rice. Now, let's talk about drinking water. These 6 states have been ranked as the worst for containing high levels of arsenic in their tap water. They're Arizona, California, New Mexico, Michigan, Minnesota, and Nevada. Now, these aren't the only states with arsenic problems. According to the United States Geological Survey Group, certain states with aquifers that supply their city's water can have higher than normal levels of arsenic. Even if your city or state doesn't have high levels of arsenic in the tap water, be aware that there are still many other health-damaging chemicals like chloride, fluoride, and pharmaceutical drugs, believe it or not, that occur in your tap water. So I always recommend that my patients use a carbon block water filtration system for their drinking and bathing water. In our own home and in our clinic, we've used the filtration system from aquasana.com, and I'll put that link for you down below. We have no affiliation with this company, nor are they sponsoring us. We've simply used their products for 15 years and know how effective they are. The other thing I really like about this company is that their systems are affordable. Okay, next, let's take a look at the heavy metal cadmium. Cigarette smokers are exposed to ongoing levels of this heavy metal. Also, conventional produce farming has higher levels of cadmium in fruits and vegetables due to the fertilizers that are being used than does organic farming. So, how does all of this circle back to peripheral neuropathy? Well, heavy metals of any kind are neurotoxic, meaning they're poisonous to the nerves, and they can do extensive damage with time to both the peripheral and the central nervous system. I've seen cases where this can be the sole causative agent of a patient's peripheral neuropathy, or where it's definitely a contributing factor for the worsening of their neuropathy. Okay, let's move on to another hidden and overlooked cause of peripheral neuropathy, and that's contrast dyes used in medical studies like MRIs, CT scans, fluoroscopy, endoscopy, and colonoscopy. These are often hidden culprits in developing peripheral neuropathy. These dyes are used to provide better imaging. However, because they contain large amounts of chemicals like iodine, gadolinium, or barium, they can cause long-term damage to the body as well as the nervous system. By the way, both barium and gadolinium are heavy metals. And I've got to tell you guys, we've seen patients in our clinic that develop peripheral neuropathy right after they went through one of these contrast dyes story. Also, interestingly enough, if you do a Google search for Chuck Norris's wife, you'll see that his wife developed peripheral neuropathy also after one of these contrast studies. Well, these dyes are neurotoxic, and they can cause extensive damage to peripheral nerves. Another hidden cause of peripheral neuropathy is the use of organophosphates. These are the main chemicals found in pesticides, herbicides, and insecticides. According to the study published on these chemicals, they've been found to be neurotoxic for both humans and animals. So that includes our precious little fur babies. Well, this is a good time to talk about chemicals in food or beverages that are linked with nerve damage. Let's start with MSG, monosodium glutamate. This is an excitotoxin, meaning it has the ability to overstimulate neurons or nerve receptors, which can lead to widespread damage or nerve cell death. Some of you still refuse to believe this and chalk it up to a conspiracy theory. Well, guess what? You're correct about the conspiracy theory, but the conspiracy is on behalf of the commercial food industry. Did you know that they go to amazing lengths to cover up the presence of MSG in your foods by using a whole host of different names for it, like natural flavors or flavor enhancer, bouillon and broth, whey protein isolate, calcium or sodium caseinate, yeast food, yeast nutrient, or autolyzed yeast. These are just a few of the deceptive terms used to hide MSG on food labels. There are many, many more than just these terms. And I'll put a link in the description box down below so you can view all of the other deceptive terms used to conceal MSG in the foods or the beverages that we're consuming. So next, we need to talk about artificial sweeteners like aspartame and sucralose. There are literally hundreds upon hundreds of research studies stemming from the 1980s to the current day on the adverse effects of aspartame on the nervous system and the body. Aspartame has not only been linked with peripheral neuropathy, but it's also been linked with seizures, Alzheimer's disease, stroke, cancers like leukemia and lymphoma, and cardiovascular disease. By the way, one more important fact to know is that both MSG and aspartame have the ability to cross the blood-brain barrier and the placental barrier in pregnant women. So before you jump ship and start using sucralose, which is sold under the brand name of Splenda, you need to know that a brand new research study was just released showing that this sweetener can be toxic to your genes and have a negative impact on your DNA. I've included the link to this study below also for you. And other research studies have shown that sucralose can alter your gut microbiome by reducing your good bacteria by half. Sucralose has also been shown to increase systemic inflammation in the body. Okay, now you're aware of some dangerous culprits that may be the cause or contributing agent to your peripheral neuropathy. So what do you do? Well, the first thing you want to do is limit and prevent your exposure to these harmful toxins and chemicals. Gang, stop using commercial insecticides in or around your home. It's not good for your health and it's not good for your fur babies. You can go on YouTube or anywhere on the net and get recipes for DIY insecticides for your home or your garden. As a matter of fact, Dr. C and I use things like boric acid or diatomaceous earth in our own home that are much safer alternatives. Okay, the next thing you want to do is get those amalgams out of your mouth, guys. This is imperative. But you can't go to any general dentist to do this. The process of removing them can cause even more harm when you mobilize the mercury. So you need to use a SMART, or Smart Certified Dentist. These dentists have received special training and a certification to safety removal of the mercury from your mouth. If it's not done right, you can end up with even more health problems. Okay, the next thing you want to do is avoid eating the larger fish that have the highest concentration of mercury. Okay, another thing you want to do is buy as much of your produce organically. Now, I know organic isn't cheap, guys, especially if you're buying it from leading health food stores like Whole Foods, Sprouts, or Trader Joe's. However, Costco now carries a large line of organic produce that's much less expensive. Just that alone is worth the cost of a Costco membership. If you absolutely can't afford to buy any produce organically, then shop according to the Dirty Dozen list. This is a list that has been put out by the Environmental Working Group, and they release this list each year that categorizes the highest amounts of pesticides in fruits and in veggies. So if you can't afford organic, then know which produce has the highest levels of pesticides and avoid eating it. Okay, the next thing you want to do is try to avoid contrast dye studies unless your life depends upon it if you can. If you absolutely have to have a contrast study, I would recommend taking activated charcoal the day before, the day of the test, and for 1 week following the test. And this won't interfere with the study at all. Activated charcoal adsorbs many toxic substances and poisonous chemicals onto its surface and prevents it from being absorbed into the body. The next thing you want to do is please stop using artificial sweeteners. These are destroying your nervous system and so many other systems in your body. Stick with all natural sweeteners like monk fruit, and yes, you can use stevia as well. Now, improve your liver function to help remove many of these chemicals from your body so they don't get stored in your tissues and wreak havoc for years. The best way to do this is by consuming foods that support your liver function to clear out toxins. These foods are beetroots, radishes, turmeric, cruciferous vegetables, and leafy greens, also garlic, carrots, avocados, apples, and citrus fruits. There are also supplements that you can take which support your liver detoxification pathways like NAC or N-acetylcysteine. Also dandelion root, milk thistle, burdock root, yellow dock, turmeric, and ginger. By incorporating these principles into your life, you'll be clearing the path to allow your nerves to reach a full recovery. Well, gang, although it's disheartening to think about the countless individuals who have been handed the diagnosis of idiopathic peripheral neuropathy, we've begun to shed light on some of the hidden and often overlooked causes of this condition. While the journey to recovery may be challenging, it's not impossible. The first step is to advocate for yourself by becoming empowered with knowledge and seek out healthcare providers who are willing to dig deep to uncover the root cause of your condition. Don't settle for a hasty diagnosis or a one-size-fits-all approach. Remember, you are not alone in this journey. Your recovery is within reach, and with the right approach, you can reclaim your life and start living again. And never lose sight of the resilience and the strength that resides within each of you. If you enjoyed today's video, please make sure you like it and share it with others, and don't forget to click on the bell to get notified as soon as we release new content. Together, we can unlock the mysteries of peripheral neuropathy and pave the pathway for healing and recovery. I look forward to seeing you on the road to great nerve health. Blessings. Okay, the next thing you want to do is avoid eating the larger fish. The larger fish? Avoid eating the larger fish. Okay. Neurodegenerative diseases, autoimmune, and chronic illnesses. So let's take a look at some of these. Right, Chloe? No? You're more interested in looking up there? All right, no problem.